Thanks for joining today's Medicare webinar, What's Changing and Why You Need a Review This Year. My name is Joshua Rockwood. I'm a Medicare broker in multiple states, and I work with many of the top carriers. That's important to you because I have access to a lot of information. I can help you understand what plan you're on and what plan might be the right one for you in your area. Now, this evening, we're going to go over some of the biggest changes in Medicare, some of the things you should really be looking for, and why we think that you should get a plan review this year. So I'm going to wait a couple moments just to let everybody hop on, and then we'll get started in a couple minutes. Please put down in the chat what your name is and where you're located. And then if you have any questions, I'd love to hear what your most important questions that you want to have answered today are. We'll be right back with you. All right, looks like a bunch of people are hopping on, so we're going to get right into it. Honor your time this evening. All right, so what's changing this year? Before we get into that, I'm just going to go over some quick Medicare rules that I need to just call out so that you understand. First of all, we have specific and very strict rules that we have to follow on how we're allowed to present plans. If you want to discuss specific plans and your specific needs, we do need to schedule a one-on-one call, or you can call us directly to initiate the conversation. We'll review your needs, research your options, and then we'll meet a second time to go over any recommendations that we have. We do not offer every plan available in your area. Any information provided is limited to those plans we do offer in your area. Contact medicare.gov 1-800-MEDICARE or your local SHIP office to get information on all plans. All right, here we go. All right. So Medicare is changing significantly in 2026. Some of the costs, drug coverage, and provider access all could be affected depending on the plan and the area that you're in. Even if your plan name stays the same, often the benefits are going to change, whether it's the max out of pocket, the dental, the costs to see your providers, things like that. So we'll go over some of those big changes to help you understand that. And then we're going to also cover the pain points and how excuse me tonight, I'm having a hard time talking some of this, and how we think a free plan review will help you get the most out of your Medicare. All right. So let's get right into it. So Medicare costs are rising in 2026. A few of the things that we know for sure are rising. Part B premiums, they're projected to rise to around $206.50 per month. The Part B deductible is going to increase up to $288. So what that means is, that deductible could be added to your Medicare Advantage plan. And if you have a supplement, that's definitely going to be there. There are ways that we can get around the Part B premium for certain clients, so we can look into that. Part D prescription drug deductibles, they're going to reach $615 this year. So they're going up in many plans. So we want to pay attention to that, see how that's going to affect your particular case. And then lastly, the Part A hospital deductible is going to climb again this year up to $1,796. Very important to understand how that can affect you, especially if you could be ending up in the hospital in the coming year. All right, so some of those things can be really scary, and we're going to walk through in a little bit more detail to help you understand exactly what it is that you can expect in this coming year. All right, so when we look at prescription drug changes, first of all, the max out of pocket for your prescription drug coverage went up to $2,100. Now, that does not necessarily hold true to all prescriptions. We're looking at the prescriptions that are in the formulary, and then there's a formula that's also going to take into account when we look at that $2,100. It's a little complicated, but we can look at your individual plan and show you what to expect. Number two, the formularies are changing. Some drugs that were covered last year are not going to be covered on your specific plan, and some drugs that weren't covered might be. So we want to look and see if you need to stay on the same prescription plan to get the benefits that you need, or if maybe you need to look at a different option. Additionally, those tiers are going to change. So some drugs that were tier 1 last year could be tier 2. We've seen some go from tier 2 to tier 3 or 4. So we want to be really cautious with that. And then additionally, pharmacy and network changes. There's a lot of that. Just this afternoon, I met with a client who was on a specific plan and they loved their small local pharmacy. They've been there for 30 years. But unfortunately, that plan is no longer going to be in network with their pharmacy. So if they stay with their pharmacy, it's going to cost them $28,000 for their prescriptions. Imagine that bill when you got there January 1st to get your scripts. So instead, we had to make a decision between changing plans or changing pharmacies. So we spent some time with that today, and we were able to get their cost down to $1,300 instead of $28,000. Had they not met with me, they wouldn't have known. So if you do want to schedule that review, click the button down below. It's going to give you an opportunity to schedule a one-on-one review with me. It's no cost to it, no obligation. We just go through, look at your information, and make sure that you know what plan you have, know the benefits of that plan, and know what changes you have. And then additionally, I do get paid if I help you, but I get paid by the insurance carrier, so there's never any cost to you for this free service. Number three, Medicare is going to be negotiating drug prices throughout the year, so there can be some changes during the year. So when we meet, we're going to tell you what we think your estimated drug costs are going to be. And we'll go into as much detail as we can, and then we want to make sure that you have somebody you can call if something happens in the middle of the year to make sure we can find a solution. Automatic enrollment into the monthly billing program is a potential. So we want to make sure you know if that's going to happen for you or not. If you do want to opt out, we can help you do that as well. All right. So I hope that's helpful on the prescription drug side of things. Now, some other changes are happening as well this year. So let's get a look at that. Here we go. So Medicare Advantage networks are also changing. So prescription pharmacy, on the prescription sides, the pharmacy networks are changing, but on the doctor side, the doctor networks are also changing. Hospitals might not be in network anymore. Doctors might not be in network. So we want to make sure that you understand how that looks for you, for your plan, and for your doctors in your hospitals. Just this afternoon, I was meeting with a client who sees a doctor named Dr. Jane Lamp in Florida. And Dr. Lamp was in network with this carrier for years and years and years, and now she's no longer in network. But it's not that simple. I went on Medicare.gov to look up this doctor, and she's showing in network. I went to another site, and she's showing she's out of network. So I ended up having to call the doctor, spent 30 or 40 minutes on this client to try to help him out. And we found out that the doctor really is not going to be in network, so they actually have to either pay out-of-network fees for this doctor. Luckily, they're on a PPO, so we can do that. Or they would have to actually switch plans just so that they can see the doctor that is so important to them. CMS is imposing stricter regulations on prior authorizations. So for many of your plans, you're going to need to get prior authorization. That's going to be scary, but we can walk you through how to do that so it's not so scary, not so hard, and just to protect yourself. See, we already went over doctors and specialists not being networked, but it's the same thing with hospitals. Some of the hospital networks are changing. In my specific area, there's one hospital that's not taking 3 of the top name carriers this year. Cigna, Humana, and United Healthcare all won't be available at one of the biggest hospitals in our county. So we want to understand how that's going to look in your county and with the hospitals that you prefer. And then also access to procedures might be delayed or denied based on prior authorizations. So we want to make sure that you understand what could be covered with your plan and how that plan can work for you. If you guys have questions as we're talking through this, please put them in the chat. We'll get right back to you as quick as we can with your answers. And again, if you want to have a one-on-one session with me to go over your individual needs, also just click that button below and let's take a look. All right, I'm going to change slides here. All right. So in past years, there's been a lot of additional benefits, extra benefits, free benefits. And if you hear all kinds of different words used in advertising, on social media, over the internet, and even in those countless piles of mail that come in your mailbox every day. So what do those mean? Are they really free benefits? And are they going to help you? Now, it's different from plan to plan for sure, but there's also ways we can tell you and show you how exactly those benefits will affect you, if they're going to be right for you, and if you even qualify for them. A lot of the plans this year are reducing and restricting the extras like the over-the-counter card. One of the top carriers is restricting their dental. Not only are they restricting it, their allowable benefits going down, but on top of that, you could have a 20 to 70% co-insurance when you go to your dentist. So want to know that, especially if you got dental procedures scheduled for next year. Some of the other perks are only going to be usable at certain vendors next year. Grocery cards is one of those things. Over-the-counter cards. Some of the physical fitness locations, Silver Sneakers, and things like that are changing as well. So let's take a look at your plan, see how and where those changes are occurring. And then a lot of times there's clients out there enrolled in plans and they don't know what benefits they have. So we want to help you by going through your individual plan, calling out each individual benefit that you have, seeing if you need them now, and then halfway through the year, we'll check again and see if you need them. Some of those benefits might not make sense currently, but you never know down the road when you need them. So it's important to know those benefits. All right. I hope you guys are getting a lot out of this Medicare webinar. If you have questions, again, please put them in the chat, or you can even call later after this webinar is over, and we can answer them that way as well. So one of the big things that we're seeing happening this year that hasn't happened as much in the past, your plan can change even if you don't change the plan. So co-payments are changing. Maximum out-of-pockets are changing. I saw one plan today that went up by $2,050 on their max out-of-pocket. The network's changing like we spoke of. Coverage rules, drug tiers, they're all subject to change this year. And some of them are scary. Some people have to move plans to get the best coverage. And it's not a matter of little things. It could be a matter of huge things. Drug costs going through the roof because a certain prescription that you must have is no longer on the formulary with your current carrier. So staying on your current plan doesn't mean that your plan's going to stay the same. We want to kind of kick that around a lot because there's a lot of that we're seeing. We don't want you to get to January 1st, go to the doctors and find out that your plan has changed and you weren't aware of that. All right. We're moving right along. Guys, keep putting those questions in the chat. Either myself or Ashley will get to them right away. We'll get back to you so that you have the answers that you need. We're also hearing a lot of things in the news about Medicare's long-term stability being tested between budget pressure, many automatic cuts that might be happening, new programs that might reduce or delay coverage, and even choosing a stable plan. This year is more important than ever. Last year, due to a lot of the changes that occurred from the Inflation Reduction Act and some other things that went into place, some of the plans had a really, really hard time becoming profitable last year. We've actually seen some carriers that were in the red, and we've seen some that made less than 0.5% of profit. Now, You can't run a business successfully and be able to take care of your clients earning that low of a profit. So we want to make sure that you're in a plan that's going to be strong and be able to take care of you throughout the whole year. All right. So when we sit down, when you schedule with us and we sit down, I want you to understand what happens and how that plan will go. So first of all, like I said earlier, there's no cost to you. We only get paid if we help you enroll in a plan that's better for you, and we get paid by the carriers, not by you. So never write an insurance agent a check, because that's not how we get paid. We get paid by those carriers. I want to make sure you never get hurt by that. So there's no cost to you to sit down. It takes 30 minutes. We can do it over the phone. We can do it over Zoom, whatever your preference is. So first, we're going to review your current coverage, your current plan, to see what changes are going to happen for next year. We're going to ask you what you like about your plan, what you don't like about your plan, and make sure that you're getting the most out of that plan. And if it's the right plan for you, we're going to say, great, here's the changes, stay with it, it's going to be right for you. And a lot of times that happens, but we want you to know if there's going to be max out-of-pocket changes, what to expect for co-pays, and what to expect for the extra benefits. From there, we may also look at other plans. So if your doctor's not in network, or your prescription cost is going up, or you're not getting the benefits you need, we'll compare with other carriers or even the same carrier in other plans. We'll go side by side and go through line by line until you find the right plan for you. We're going to check those prescription costs. We're going to check your pharmacies, your doctors, your hospitals. And then also, we're going to help you evaluate if you are eligible for things like LIS, Medicaid, a C-SNP plan or a D-SNP plan, or even a veteran plan. All those different options can give you additional benefits if you qualify for them. And quite often, people qualify and they don't know. Some of those benefits are huge and life-changing, both on the access to healthcare side and the access to extra benefits. All right. Guys, one more time, just if you have questions, please continue to put them in the chat. We'll get those answered for you. So we've talked about a couple of clients so far, but I want to show you on a slide a couple of real people, real results. So this client, we were able to give her $94 savings per month on her insulin. Current plan, her insulin went up to $94. We were able to switch that plan over to get her $0 insulin. We caught that her primary care was going to be dropped, and so we found a plan that also had her primary care in network, and we found that she was eligible for extra help, so that her prescriptions actually were going to cost $0 on top of her insulin being $0. We found a plan that all of her prescriptions were going to be closer to $0. It wasn't exactly zero, but very close. These reviews can make a real big difference, and that's why we love to help with those. So from there, guys, any more questions and concerns that come up, let me know, and we'll get those answered. And I want to get you scheduled. Let's plan a review for 2026. Our annual enrollment period goes from October 15th through December 7th. Review early. The more time you have, the less stress. So at this time of year, if we go in and we review your plan, we've got a couple of weeks before you need to get changed if you don't want to make a change right away, so you can think about it. Step one is to schedule that 15-minute call. Then I'm going to do the research. And from then, step 3, we'll be able to meet again with your best fit, your best options. From there, we'll see if you want to get enrolled in a new plan, and we'll help you through the whole process. And then not only that, that's not when we end our relationship with you. Our relationship ends only when you tell us you want it to end. So from the time that you get enrolled, we're going to be in contact every couple of weeks, every couple of months, just with a simple text or a phone call, just to say, hey, how's your plan going? Is there any questions or concerns? And then when you have a question, you just call us, text us, email us, whatever your preferred method is. We're going to get that taken care of for you. We're going to get your answers right away, and we're going to get them quickly without you having to be on hold for long periods of time, without you having to call multiple people. We know most of the information. If we don't, we have the sources to find it quickly so that your Medicare experience doesn't have to take over your life. It can be a good, make it a good experience for you. All right. Oops. I clicked off my slideshow. Oh no. Let's do this one more time real quick. I'm a real person here. I'm not perfect. That is for sure. All right. So I'm just going to show that last slide. I've got 2 more slides. We'll just put this up here again so you can see it. Again, schedule the review by clicking below to schedule or giving us a phone call at the number that's listed in the next slide. Step 1 will be to schedule that. Step 2, we'll do that 15-minute call. We'll do the research afterwards, and then we'll meet a second time to go over your best fit, your best options. All right, so if you want to reach out to us, Josh at rocketgrowthstrategies.com or 910-971-2555. Again, the link is here on the screen. If you want to actually write that down, I'll leave it up for a moment. And lastly, you can always click below. Please continue to enter your questions. We're going to get those answered as quickly as possible. There's quite a few popping in there, but we'll get them answered for you. Thanks again for hopping on tonight. I look forward to working with you. Take care.